But today, beginning the show, as we have for the last few Wednesdays, we are joined by OrthoVirginia's Dr. Anup Gangavalli. Dr. Gangavalli has specialties in back and neck injuries and trauma care. He joins us this Wednesday morning to chat about back pain, back injuries around the sports world, all of that fun stuff. Doctor, thank you so much for taking some time out of your morning to chat with us. How are you doing?
Good morning. Thanks for having me. Doing well.
Thank you for carving some time out of what I imagine is a busy schedule. So thank you for carving that out as well.
Of course, anytime.
So kind of just off the top here, how long have you been associated with OrthoVirginia, been working with them?
4 years now. Before this, I was in South Florida, and before that, Cleveland. As you know, in medical training, we travel all around. So been enjoying the Richmond climate for the last 4 years.
That's awesome. How'd you get involved in back and neck and things of that sort?
That's a long story, but the short version of it is my dad. When I was going through medical school, my dad had some back problems, and he was an avid tennis player. And we used to enjoy playing, pretty vigorous games of tennis. And he used to beat me a lot. And finally, he had this back issue, and then I beat him for the first time. Then he had his back fixed, and then the roles reversed again. So I saw the great recovery that individuals can make, after having spinal issues addressed. And so that piqued my curiosity, and through medical school and further advanced training, I decided that I would focus in on the spine.
That's awesome. And we're going to talk today about some injuries around the NFL, around the world of sports, of course. And do just want to say you're not treating these athletes, not working with the teams, just sharing expertise on back injuries in and of itself. But you mentioned it there, kind of why you got into back injuries. How can those types of things, back, spine, impact other parts of the body and bring you down?
Of course. So, the way we think of the spine, it's sort of the structure that holds your body upright. It also houses all of the nervous system. So the main wiring of the body is housed within the spine itself. So sometimes, unfortunately, if individuals hurt their backs, their spines, necks, it can pinch the wiring or the nervous system that affect other parts of the body. For instance, if you injure your neck, the nerves in the neck control your upper extremities, dexterity, motor function to your hands, arms, shoulders, elbows, etc. And similarly, the nerves in your lower back control your legs. So balance and coordination, ability to walk, etc. can be affected. So what we perceive as arm pain and leg pain could actually originate from an injury or degenerative or wear and tear situations of the spine itself. So what we feel as pain in an extremity can actually be originating from your back or neck.
So what types of back injuries do you see the most often with athletes? Do they come in typically with some arm pain or an arm injury, and then you can kind of trace it back? What do you typically see out of athletes?
Sure. I see a lot of college athletes that sometimes we'll get into a game and they'll be hit from the side, and they encounter symptoms consistent with whiplash, where their body moves, but their head tries to maintain a stable position, and so their body gets torqued in a certain angle. That can lead to muscle strains, ligament sprains, and sometimes even herniated discs. Football players, particularly when they get hit violently, and their head and neck angle changes pretty rapidly, can actually pinch a nerve in their neck or upper extremities. In their neck that can result in pain shooting down their arms. We call that a stinger or a burner. And so your arm goes numb and your arm can go limp sometimes. And oftentimes it can resolve in young athletes. Sometimes, depending on how violently you were hit, it can result in some further damage that needs, evaluation with some advanced imaging, MRIs and things like that. But yeah, specific to athletes and football players, these are definitely some of the injuries that we see. Side hits from the back can result in small, chip fractures off the side of the spine. More vigorous injuries, weight room injuries. We see a lot of those where the vertebra can actually compress down, and you can have subtle compression fractures of the spine. This is also common in older patients. But aside from the routine muscular strains and aches, and bumps and bruises. Spinal injuries can occur from football as well.
So far this season, it feels like we haven't seen thankfully, a ton of back injuries, at least high-profile ones, thankfully. But what is it, or is there something that you have seen over the last couple of years that may help kind of bring down back injuries? Is there things athletes are doing or other things that people are doing that can help them avoid back injuries?
I think our knowledge of, sort of the musculoskeletal science and general fitness has vastly improved. I think, plyometric training and sort of awareness of posture and stability has also improved. So, our athletes, aside from nutrition, the recovery phase, all of these things, we're paying attention to that now on the sidelines and in the training room. So these are all things that are lending themselves to stronger athletes who can recover a little bit better, and they've got better body position knowledge and things like that to avoid injuries in the first place. Protective equipment, helmets, pads, they're getting better too, thank goodness. So we do see injuries, but less than before.
Yeah, that's a great point. The pads, the protective equipment also helping a lot. But we've been talking a little bit about back, spine. Can you kind of explain the difference between those two types of injuries?
Sure. So when we consider the back, I really like to break it down into, the different parts of the back. There's always the neck or the cervical spine, as we refer to. Then there's the mid back, which is in the trunk of your body, and the lower back, which is just above the pelvis. The back, when you kind of take it apart in layers, there's always the skin and the soft tissues, followed by the muscular tissues and the connective tissues. And then ultimately there's the spine, which is the bony substructure, which holds us upright. Within the spine, there are several segments. They sit on top of each other like little tin cans. Those are called vertebra, and they're connected with each other with several complex joints. And soft rubbery cushions in between them called discs, which are prone to injury. And so, injuries to the back could comprise a soft tissue injury, whereas, like a helmet strike to the side or helmet strike to the muscle, which can absorb a lot of that injury. And if their injury is more high energy, it can transmit all the way deeper into the level of the bones, which can result in a fracture. You can actually herniate a disc or rupture one of those softer tissues in between the vertebra itself. So the back is a more all-encompassing word. The spine is a more inside, deepest substructure that holds you upright.
Okay, that makes a lot of sense. Is there a difference on how you do or treat patients with maybe an upper back injury compared to a lower back injury?
Sure. Yeah. So upper back and neck injuries, the cornerstone of all of our treatments first is, we observe the patient, we find out what their goals are, what their baseline functionality is, and we try to take the most minimally invasive or least invasive approach. We try all the simple things first. We try to get them rehabilitated with physical therapy, strengthening, stretching. We try, simple medications, anti-inflammatories and steroids if needed, muscle relaxers to kind of, recondition the muscles and soft tissues first. A lot of the injuries happen to be soft tissue, and if treated as such, we're often, very successful. As it pertains to the upper back and the lower back and different parts of the spine, the demands of those parts of the spine are completely different. The upper back and neck is really functioning to hold your head and shoulders in the correct position so that we can operate within space. Your lower back is just generally more load bearing and for more twisting to aid in different functions. And so the design of those vertebrae are different. And so they can, similarly get injured in different ways. Your neck has fantastic range of motion. You can turn from side to side, but your lumbar spine doesn't move that much. So the injury profile that can happen to these different parts of your back are rather different.
Gotcha. Very, very enlightening. And where can listeners go if they're experiencing any back issues, any spine issues? Hopefully not, but if they are, where can they go schedule an appointment with you guys at OrthoVirginia?
Yeah, orthovirginia.com. If you're able to, log in and make a MyChart account, you can find any one of us, myself and my colleagues. If you have any spine surgical questions, you can make an appointment online, and you can search us by name, and we're happy to see you.
Awesome. Dr. Gangavalli, appreciate your time. Have a wonderful rest of your Wednesday. Thank you for taking some time to chat.
Of course. Take care. Have a good weekend.
Of course. There goes Dr. Gangavalli from OrthoVirginia taking some time out of his morning to chat with us. We greatly appreciate it. Some very, very great insights on back, spinal injuries, things of that sort.